I want to give you guys a little bit of an update about what is happening with Ebola. This was a story that we covered in our very, very first episode of Dr. America. And there is some good news to report, and there's still some work to be done. And I just kind of want to give you guys a little status update about where things are at with Ebola in West Africa. So far, there have been 21,000 cases of Ebola in Sierra Leone, Guinea, and Liberia, with 8,000 deaths. In that grim picture, there has been a little bit of good news developing very recently. 2015 is off to a good start in West Africa because every 10 to 14 days, the WHO, the World Health Organization, they're telling us that the number of new cases diagnosed has been half the number diagnosed in the previous time period. So that kind of means that, like, roughly every 10 days, fewer and fewer and fewer of people living in West Africa are being diagnosed with Ebola, and that's really good news. And I'm deeply grateful to the Ebola fighters for all their hard work in restoring health and to the communities of West Africa, and it's really their hard work that has stopped this disease from infecting millions of people, which was where the WHO said we were going to be in January 2015 if we didn't get our act together. So thank you so much to all those Ebola fighters. We really appreciate your hard work, and I do respect that they are telling us that that there is still some pretty important hard work that's left, and that we need to kind of keep up our vigilance and not fall into complacence. The director of operations for MSF, that's Médecins Sans Frontières, has summed up the current situation, saying that, quote, the decline in the number of new cases is an opportunity to focus efforts on addressing the serious weaknesses that remain in the response. We are on the right track, but reaching zero cases will be difficult unless significant improvements are made in alerting new cases and tracing those who have been in contact with them. It sounds like they've got a lot of hard work still left, especially for the more rural, tough-to-reach parts of Sierra Leone, Liberia, and New Guinea. And we really, really commend those hardworking Ebola fighters for helping our brothers and sisters in West Africa.